Hi everyone, my name is Dr. Ayolu Adekule, Head of Wellness Clinic at Redeemer's Health Village. Today I'll be answering 5 frequently asked questions by clients who come into our clinic. Health is a complete state, that involves your physical well-being, emotional, mental well-being, and your social well-being. So, because you feel fine physically, does not mean that you are well generally. So the reasons why we do a wellness test is because we need to identify risk factors first. Things that might have occurred or might almost occur before they actually occur, so you can take steps in managing them. So the frequency of your wellness test would actually depend on your medical history. So for people that have chronic medical, diseases, we want to advocate for them to do more frequent checkups. Encourage them to visit their specialist as often as they should, and then they will have more tests done in those visits. But for those with nothing, no history or anything or risk factors, we can do them every year, and there are some screening tests that should be done every 3 years, and like that. Or would advise when you see us in the hospital. So that has to be like the most asked question ever in this clinic. Well, the reasons why we would say maybe not eat is because we have some fasting tests that we tend to take. But if you're not coming to the hospital before, say, 10 a.m. in the morning, just eat so that you don't end up having to fast the whole day. The reasons why we say that 10 a.m. basically is because we aim to take our fasting samples within 8 to 12 hours after your last meal the previous night. So ideally 8 a.m. to 9 a.m. thereabouts. So that's wow. So we have a lot of tests in the package. We have various packages. So we have packages ranging from basic, standard, premier. We also have the silver, gold, and platinum. These packages are basically for everybody. We tend to advise based on gender and also based on age. So, based on your gender, that's why we have the initial consultation. When you have the consultation, we're able to advise appropriately depending on your age, and also if there are other chronic medical illnesses, then we're able to advise you appropriately. But these packages contain laboratory tests, blood work, urine, stool, and then even some radiological investigations. But when you come, you see. All right, so for that, we try to aim for maximum of 2 visits so that we don't, keep you coming to the hospital frequently. So the first visit is for contact, for initial consultations, and probably just take your blood samples, do all the radiological investigations that we have, and then second visit at most for review of your investigation results, and then for the other therapies like some packages contain some dental, some physiotherapy sessions, dietitian sessions, and all that. So that can also be done. But sometimes, depending on the package you choose, you might actually just have one day where we do everything, and then the second visit for review. Thank you so much for listening. I'm looking forward to seeing you at our wellness clinic at RHB soon. Bye.